Greetings. Welcome back to my YouTube channel. This is Mushtaq Memon, Professor Emeritus from Washington State University. This is our series of integrative veterinary medicine. And today's video is about integrative veterinary medicine in practice. So I hope that you will enjoy this information. To find out how integrative veterinary medicine is practiced, so I took sabbatical for 6 months and went to University of Florida, which is located in Gainesville, Florida, one of the premier institutions in our country here in the United States, and has also very well-known integrative veterinary medicine programs. So I took 6 months, as I said, just to focus on what the clinical services offered as part of integrative veterinary medicine, or IVM, at University of Florida. So I was going from Washington State to University of Florida. What I found out, my first impression was that the service was very busy. They had quite a few cases coming in every day. Most of the cases came in were within the teaching hospital. So the surgeons sent them cases in the service for after surgery to have a rehabilitation or after many other problems which were helped by integrative veterinary medicine. So here on this picture you see many of them are senior DVM students, final year doctor of veterinary medical students. They were spending 2 weeks of block, of the clinical block is spending up here. As you can see here, the students are working on individual dogs and doing different kind of techniques utilized. And they had all kind of equipment which are necessary to perform rehabilitation and other acupuncture therapies. So they had about 10 to 15 appointments every day. I was so impressed that I asked the clinicians there, I said, have you published this information? Because we really do not know what type of work you are doing and how beneficial it is. The response was, well, we are too busy to worry about publishing anything. So I said, well, I'm on sabbatical, I've got some time, so let me dig deep and try to figure it out, what kind of services they are given there and how they relate to everyday practice. So just to get to the point right away is that luckily they had medical records all recorded electronically. So it was easy for me to go through more than 5,000 cases during my duration there at University of Florida. So we end up publishing this paper. As you can see here in Veterinary Medicine International, peer-reviewed journal, myself and my senior clinician there, Dr. Schmalberg. So here's a summary of the case. So out of those 5,000 some patient treatment sessions, there were 274 patients which received more than one therapy, or I would say different modalities they received it. And the mean age was 9 years old. These are all canine, by the way. So they were kind of older dogs. And to my surprise, the overwhelming number of the breeds was Dachshund. And I'll show you a picture or two. These are the animals which are kind of smaller in size and very long body and close to the ground. So they obviously get in more problem than many other taller breed dogs. And almost 50% of these cases received acupuncture, laser therapy, and hydrotherapy. Now, in a veterinary teaching hospital, I'm sure most of you listeners are aware that there are so many specialized services being offered for veterinary students, for interns and residents to be trained. So as you can see here, these are different services. So as you can see on y-axis, we have the percentage of cases. On x-axis, we have the different disciplines or specialization. So right in the middle, you see a darker color black bar represents integrative medicine. So prior to that, you can see the primary care, emergency care, oncology, and there are quite a few others which received less cases than integrative medicine, including, as you can see, internal medicine, orthopedic surgery, and so on and so forth. Now, this was a very comprehensive cross-species integrative services. As you can see here on this graph, almost close to 40% cases were, canine, and then there were about 8% or so, receiving equine rehabilitation. But these small animals received mostly acupuncture, and then 21% received some other therapies, like hydrotherapy, nutrition, things like that. And there were also wildlife cases. So I was really impressed, and I had opportunity to do some acupuncture on turtles and some birds. So really acupuncture or many of the integrative therapies are applicable depending upon the species and depending upon what kind of clinical problems they have to be helped with. So here is the other part of this information. Again, the same concept. You have percentages on y-axis, and then you have different conditions on x-axis. So you could see here neurological and orthopedic problems are almost 50% of all the other cases seen there. But I would like to make a point here that there were cases which are related to internal medicine, oncology, soft tissue, critical care. So in other words, all these different disciplines the animals are affected with, I think could be helped by integrative medicine. So here I was a veterinarian, a specialist in clinical reproduction or theriogenology. So my colleagues at Integrative Medical Services asked me, and they said, you are a senior clinician in your own area of theriogenology. How much you remember or how much you know about orthopedic surgery or neurology? Because we receive about 50% of the cases. So I asked them, what do you mean by that? They said, well, see, when cases come to us in our service, we try to evaluate those cases, we examine them, and then figure it out what therapy they need. And once the therapy is instituted, then we evaluate them and did the therapy work. So we want to make sure that you are aware of the different criteria, how animal could be evaluated for orthopedic problems. Then you can, assess then afterwards too, how much success you had. Same with about neurological problems. So I said, what is in mind? They said, well, would you mind to spend 2 weeks in orthopedic surgery and 2 weeks in neurology so that you can get really feel for it and also study and learn more about it. I said, no problem, I will do that. So here I am now coming to orthopedic surgery first. As you can see on your left-hand side, gentleman in kind of reddish, brownish shirt there, Dr. Dan Lewis, outstanding professor of orthopedic surgery at University of Florida. So he kind of took me under his wings, if you will. And he said, no problem, come on in, but we have got few conditions for you. Number one is that here we are all well dressed in terms of, we deal with clients, and they are mostly canine and feline clinics, clients, and they're mostly folks from cities, so you have to be really well dressed. So here I went to the shop and got some clean shirts and ties. So here I am observing on your left-hand side how Dr. Dan Lewis is doing the examination of this German Shepherd dog. Then I tried to evaluate whatever I had learned from there. So it was an outstanding experience, and Dr. Lewis was so kind to take me with him in the surgeries, and I really come to appreciate that how diligent work they do in orthopedic surgery. The exciting thing is on this other slide on your right hand side. Now here is the client which is having their dog discharged from the hospital. So Dr. Dan Lewis is giving her the instructions for medications, what needs to be given, what needs to be done. But on his right-hand side, the lady who is sitting on the floor, talking, so to speak, with the dog, is the clinician from rehab service, from the Integrative Veterinary Medicine Service. So they both together, from orthopedic surgery and from integrative medicine, because this dog, this animal, received service from both disciplines. So the owner received instructions combined jointly from both services. And I think this is the ideal thing, which I really love to see in our profession, that our specialists, come together and try to help our, patients in the best way we can. And then the neurosurgery, that was another, very, very impressive service. I just couldn't believe that how these neurosurgeons could be standing on their feet for hours trying to do these surgeries. So I really come to appreciate this service very well and understood some of those things which were going on. So here's a typical surgical suite. There are 2 suites there, and the surgeries are going on at the same time. And I was impressed with their clinical technical services. So there's one technician sitting in the middle of both surgical suites, providing service and needs whatever they need in either room. So on your right-hand side is our dachshund dog, which we talked about. A fairly large number were dachshund breeds. So this is a dog which had just came out of the neurosurgery and now going through rehabilitation. So one thing which was also fairly impressive for me, going from Washington State University, where was integrative medicine almost, close to non-existing, to this place where they had specialized exam rooms for integrative veterinary medicine, and people came from very far away distances to come and see clinician. So I think this is a testimony to this service or this type of practice, that those of you, the veterinary students or veterinarians and others who are thinking about, how successful their service would be, based upon my observation, I think if a person has the capabilities and competence, people come pretty far away to seek you out. So then a typical veterinary teaching hospital system works in a way that the senior veterinary students go and receive the client, take the history, do the Western examination, and in this situation in integrative vet med, in addition to Western physical examination, they would also do traditional Chinese veterinary examination of the animal. Then they create a differential diagnosis list, what could be wrong with that animal. Then the student would come and discuss with the senior clinician, and then they will try to figure it out from the student's, differential diagnosis, what could be next. So in the top picture, you see the senior student is discussing her findings with Dr. Shea, one of the senior clinicians, and he, and the bottom slide is Dr. Schmalberg. These are the 2 clinicians that I worked very closely. So here is a traditional Chinese veterinary examination. There are 2 very unique things in the traditional Chinese veterinary medicine. One is the tongue examination. And as you can see, Dr. Shea in our left-hand side slide is trying to look at the tongue of this dog, which we'll discuss a little more in my next video. And then on the other slide, on your right-hand side, Dr. Shea is looking at the pulse findings, pulse examination. There's another thing which is very, very important in Chinese examination. So again, as I said, I will go a little more in depth on those 2 techniques in our next video. Other things which we saw early on slide, I told you that also a large number of dogs received hydrotherapy. So what we are talking about on the right-hand side is our underwater treadmill that dogs are brought in, and they try to walk through the water. and then water has a speed, so then you give them exercise in that way. But sometimes the animals are so chronically ill that they are also old. They are not able to even put weight on the floor of the treadmill. So they are good candidate to bring them in the swimming pool on left-hand side. You see, so dog is being given exercise in the swimming pool. And my observation was the senior students really like also this exercise. So here's a senior student trying to be with the dog in the swimming pool. There are a variety of other exercises, which I hopefully will discuss with you in subsequent videos. As you can see here, therapeutic exercises could be just different techniques of rehabilitation. It could be balance ball, as you can see here, or it could be cavaletti poles. As you can see, the dog is trying to climb these poles here. So I have included the reference of this paper for you to go a little deeper. And I'm so pleased to share with you this, our recent book came out about a few months ago. It's to be in August of 2023, which is probably the first textbook on integrative veterinary medicine. The other thing which I have started is my own YouTube channel, which you are watching now. And we have, this is I think third video on integrative veterinary medicine. So I would encourage you to keep on looking at these videos. The best way would be, then I would appreciate if you could like, share, and subscribe this channel so that you will keep on receiving the reminder that next video has showed up now that you can watch it. So my next video is going to be on traditional Chinese veterinary medicine. So I look forward to seeing you there. Thank you for listening. Bye-bye.